The Honourable Leader of the New Democratic Party.
Thank you. Mr. Speaker, if we were to pinpoint on a map of Nova Scotia all the communities that have suffered closure of their emergency rooms in their hospitals since we began this session on the 27th of February, we would do a lot of pinpointing. Annapolis Royal, Sheet Harbour, Middle Musquodoboit, Tatamagouche, Pugwash, Parsboro, Spring Hill, Strait Richmond, Bedeque, New Waterford, Glace Bay, North Sydney. And so as the session comes to a close today, I want to ask the Premier this. Can he name one, anyone, just one, of these communities where the situation of ER closures is one bit better today than it was when he came to power?
The Honourable Premier.
Yeah, Mr. Speaker, I want to thank the honourable member for the question. Mr. Speaker, I think the optimism that we're hearing from Nova Scotia across the communities, the healthcare workers, you mentioned Tatamagouche, we know they get a full complement of physicians that are working. Soldiers Memorial Hospital, which the honourable member would know, I heard him reference Annapolis, which is also in my riding, Mr. Speaker. They seem very encouraged with the representation they had and the work that's ongoing. I want to thank the many people across the communities who continue to work with us. We've worked with the communities from one end of the province. We know, Mr. Speaker, there's more work to do. The honourable member has raised this important issue many times. I thank him for bringing it up, and we're going to continue to work with our healthcare providers to make sure that we have the appropriate complement of healthcare teams across the province.
The Honourable Leader of the New Democratic Party.
Thank you. Mr. Speaker, yesterday the government completed the legislating of the second budget in a year which has funded 0 new nursing home beds anywhere in Nova Scotia. And the result is that 1 in 5, 21% of the hospital beds in the province today are filled with seniors waiting for placement in a nursing home. Now, every time I have asked the Premier about this through this session, he has responded about home care or about the wait list. But I want to challenge the Premier to answer this simple question without reference to the wait lists or to home care. Can he name a single healthcare professional in the province who thinks that 1 in 5 hospital beds being filled with non-hospital patients is an efficient or an appropriate use of our hospital resources?
The Honourable Premier.
Thank you, Mr. Speaker. Mr. Speaker, the challenge with the honourable member's question, Mr. Speaker, you can't look at one aspect of delivering health care without looking at it in a totality, Mr. Speaker. Of course, it's important that we invest in home care. The honourable member should know that, because the people that he is talking to, and his constituents and all Nova Scotia, will tell him and tell all of us they want to remain home as long as possible. That's why we've continued to reduce the list. Mr. Speaker, and I said before in this House to the honourable member, we'll continue to look where long-term care beds are required in the province, Mr. Speaker, and if it's deemed, Mr. Speaker, that the challenge or the opportunities that we've taken to work on with home care and reducing long-term care lists, we'll make those investments at the appropriate time.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Here's one aspect that people would like the government to look at. On the day when the first session of this government's second mandate closed, that was last October, the number of people on the official registry of people looking for a family doctor was 37,339. Today, as this session closes, there are 44,158 people on that list. So I want to ask the Premier, why would anybody think his government has a credible handle and grasp on the doctor shortage when from just one legislative session to the next legislative session, there are 7,000 new people on that list?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. He raises a very important issue and identifies the challenge, Mr. Speaker, with as we deal with this issue, Mr. Speaker, in one community we're having retirements, in another where we're having that wait list grow. Quite frankly, it is too many. I hear the members of the official opposition. I want to answer the honourable member's question because he answered in a thoughtful way and he's listened respectfully. I would encourage the official opposition to do the same thing, Mr. Speaker. This is an important question, Mr. Speaker.
Order, please. The Honourable Premier.
Mr. Speaker, I want to answer the honourable member's question. The fact of the matter is, the issue that he raises in this House is a real challenge. As we continue, Mr. Speaker, to deal with the issue in some communities, we're seeing it in others. The fact of the matter is, Mr. Speaker, there had been a physician resource plan that identified, and they were basing solely on age, that physicians would retire in this pace. Well, that's not the reality that's happening inside of our province, Mr. Speaker. We've discovered that new physicians that are coming in want to have a smaller practice and want to practice differently. So the honourable member raised a very important issue. We're working with Doctors Nova Scotia to continue to make sure we address the very important thing you've brought to the floor of the House today.